Government Communication and Information Systems are today hosting a media briefing of the Social Protection, Community and Human Development Cluster led by Minister of Health, Dr. Phaahla, and Basic Education Minister Angie Motshekga. This follows the delivery of the 2023 State of the Nation Address. The briefing will outline areas that President Ramaphosa mentioned in his speech related to departments in the cluster. Let's take you there live.
In international literacy studies, that most children do not yet reach this threshold. But we also know that the situation has improved since the previous PILS assessment and keeps on improving on an ongoing basis. Again, we have embarked on a number of programs. We have developed the reading framework, which we work on it with different partners. We have monitoring tools to assist us to also assess where making progress and where we're experiencing difficulties. So quality of support available to teachers, that has been writing subject advisors. We also are working on mobilizing parents to join us in the Read to Lead campaign. Excuse me. On education outcomes, the department has made significant inroads regarding science, technology, engineering, and mathematics. We have introduced 21st century workplace relevant new curricula, such as coding and robotics, marine studies, and we're intensely engaged with the development of aviation and aerospace curriculum in collaboration with the Department of Transport, with South African National Space Agency, and a host of academic and aviation sector agencies. We have introduced 19 new subjects to the curriculum to expose our teachers and learners to a range of skills and competencies which will equip them for the 21st century with an emphasis on innovation and lifelong learning. Teachers and learners will be able to respond to emerging technologies, including Internet of Things, artificial intelligence. We're training teachers on coding and robotics, changing world. And again, we'll give more information on the curriculum changes and innovations that we are undertaking. But we can also report that it has been 6 years since DBE started conceptual the introduction of 2 additional streams in the curriculum, namely the technical vocational and technical occupational streams. And we have been consistently reporting on the progress that we're making around the 3-stream curriculum. And this heralds a fundamental strengthening of the technical vocational and technical occupational education. Other developments in this sector include the establishment of partnerships with business and industry, given the resource-intensive nature of this program. DBE, for instance, has partnered with Ford South Africa, through which we received more than about 240 engines that were taken to schools and distributed to schools that are offering automotive specialization. And quite a number of companies also have been coming forward to partner with us in the area of vocational education and technical vocational education. The President again did allude to the Presidential Youth Initiative, and we are playing a part in the Presidential Youth Initiative with different partners. As the education sector, for instance, we were privileged to have the biggest a cut of the budget, where we're able to create more than 850 job opportunities just in the sector, excluding other departments. The upgrading and maintenance of school infrastructure remain a key priority for the sector. For this reason, we are working at different ways of dealing with this serious challenge, which amongst others includes changing the framework for educational grant, the delivery model, and also the types of structures that we offer in schools. We will be giving a dedicated report on infrastructure in education soon, because infrastructure challenges have become one of our most serious threats to the work that we do as a sector. Again, when President gave the State of the Nation address, before he did that, he visited us as an education sector, and amongst other things that we discussed also as a sector generally at our annual conference were issues of social ills in our schools, such as bullying, gender-based violence, teenage pregnancy, drugs, and alcohol peddling. And the president in his address said, and I want to improve, to quote, he called on the sector to develop tools to improve learner outcomes, recognize that quality education can only be achieved if learners and teachers are safe and healthy, and if schools are caring and are conducive spaces, free from violence, abuse, and harm. Our schools must be safe, weapons-free, substance-free spaces for learners and teachers, where corporal punishment, substance abuse, and all other negative tendencies are at schools. And we are working very hard on it. On social grants, again, we want to report that 60% of government's budget is spent on social wage, combating poverty and hunger. Not only on grants, but the 60% of the budget, part of it in education, part of it in health, and part of it in social development. So despite the budget constraints, the social development portfolio has been able to pay social grants to more than 18 million South Africans. And these grants are pockets in the form of social support grant, care dependency grant, foster care grant, old age grant, and disability grant. The country has also made serious advances to break the barriers of access to income by introducing what we call the special COVID-19 social relief of distress grant. In the education front, for instance, on the social grants, the department, on the education front, the statistics that were released by Education Department show an increase of 39,744 social grant beneficiary learners who have passed matric with very great results. On human settlement, factors for human settlement programs. The Department of Public Works worked on 14,000 hectares of state human settlement to date. 2,689 hectares have been transferred to Housing Development Agency. And the Department of Human Settlement has an additional 32 land parcels measuring 10,350 hectares to undertake preliminary human settlement planning in excess of 64,000 housing opportunities, which are planned from the released land parcel and will contribute significantly to the attainment of the prescripts of the Freedom Charter that says there shall be housing and security for all. In the last financial year, about 24,671 stands were created through informal upgrading process, and the process of upgrading includes the provision of basic services such as water, electricity, sanitation, and security of tenure. And by intensifying the informal settlement, intensifying the upgrading of informal settlements, it means that we are addressing some of the recent shocks caused by flood and fires in various parts of the country. And with climate change, natural disasters which are becoming more frequent, most in our infrastructure was designed to be resilient. In the past 5 days, our country has experienced devastating floods in KwaZulu-Natal, Eastern Cape, Limpopo, and Mpumalanga. And we believe that for an effective response to these disasters, we need land, we need South Africans to embrace each other, especially families that are homeless, vulnerable, and distressed. It is time like this that we need to collaborate, unite, and focus on solutions that will provide relief to all those that are in need. But we also want to appreciate all the offers of assistance from partners in the private and public sector. We want to extend our appreciation to our social partners who have initiated various interventions to assist in helping all those in distress. It will be a long road, we believe, but together we also believe that we can do more to minimize the impact of the devastating floods. And I want to stop at that, Chair, and thank you very much.
Thank you very much. So I'll have to go up there. Sorry, Minister. Thank you very much, Minister. Thank you very much, Minister. And on behalf, I think, Minister, and as Dr. Phaahla will tell you, the team who've worked very well. And I must say to members of the media, Minister Motshekga, I think you've given a wonderful navigation path for stories for the year. I mean, imagine what you could see when you go and see on site in Limpopo, the hospital project, in advancing, the school projects that are unfolding. There's some really exciting work that we've heard about in the statement today that points the way for us forward into the year, which is what the intention of these briefings are, to unpack a bit more in detail.
And you're watching The Agenda. Let's take it to a break now. Government Communication and Information Systems are today hosting a media briefing of the Social Protection, Community and Human Development Cluster, led by Ministers of Health, Dr. Joe Phaahla, and Basic Education Minister Angie Motshekga. This follows the delivery of the 2023 State of the Nation Address. The briefing is outlining areas that President Ramaphosa mentioned in his speech related to these departments. We were there earlier. Let's take you back there.
Members of the media who are online, please. Okay, right. So that's our first round to the ministers there. I think that's quite useful. Thank you.
Thank you very much and good morning. On the issue of cholera, the countries in our neighborhood, the major burdened country in terms of cholera is Malawi. Just over when the first cases broke on the beginning of February, there was almost just under 40,000 people already affected in various parts of Malawi, and just over 1,200 people who had already succumbed. Mozambique, also some provinces of Mozambique, more closer to the ones more closer to Malawi as well. So it's a particular corridor which affect the two countries. At this stage, the only imported cases has been the ones for those who traveled from Malawi. We haven't had cases of travelers from Mozambique. The risk of a bigger outbreak is always there because cholera is a waterborne disease, both basically water and anything which you consume, especially something which you consume uncooked. So water, as we drink, and any other fluids, of course. But usually the risk is when water sources are contaminated. Reservoirs and dams and so on, and rivers in cases where people drink untreated water. So at this stage, I would say possibly part of where we may say a bit of protection. We haven't had the cases breaking out in rural areas where people use untreated water in terms of wells and rivers. It's been because it came from traveling. It's in Gauteng, where large majority of people use treated water. So that's why you would find that thus far it's been people in close proximity, in families and those in close contact who share a lot of things, utensils and food and water. So the threat will always be there, but we're still comfortable at this stage that it's been isolated cases. So that's why we say that our environmental health, together with the various city authorities, will always be on the alert, monitoring, especially testing the water reservoirs. And at this stage, we have not had any indication of any water reservoirs which have been affected. On the issue of the infrastructure of hospitals, in Gauteng specifically, as you have said, the water challenges have been mainly associated with where the water pumps have not been functioning because of interruption of the electricity. So you will find that it will be, the hospitals will be affected together with the local residential and industrial areas. So all our hospitals do have reservoirs, but they can only last for a limited period if the water pumps are not functioning from the water storage for long periods. If there's a long period of load shedding, then that becomes a problem. So from our infrastructure grant is one of the areas which we are supporting provinces to make sure that where possible, because borehole water you're not able to find everywhere. So where it is possible to strengthen the underground water, so that can be as a supplement. As you have said, also on the load shedding side, we made some progress initially in terms of getting more health facilities to be exempted from load shedding. But at this stage, we are at a stage where both from ESCOM and also the municipalities, which are electricity distributors, have indicated certain infrastructure which needs to be, inserted in terms of cables to bypass some of where the supply of the health facility is strongly linked with the local supply of residential areas, business areas. They've given us a number of hospitals which we see as priority, where we need, they say that additional cables are required and they are not able to fund. So working again in the next financial year, we're looking at using our own infrastructure fund to work with those electricity distribution agencies, whether it be ESCOM or local municipality, to see that those additional cables, if we are able to can afford them from our infrastructure grant, we will be able to do so. But over and above that, in the coming year, our team from infrastructure working with the CSIR have also almost at the verge of completing indications of your additional power supply, your independent power supply, your solar and other batteries, which can then be rolled out. So we are saying that any new infrastructure in the coming financial year will include independent power supply, especially in terms of solar and batteries and any other technology. So we're working with the CSIR to make sure that whatever technology is implemented will be sustainable and will be able to be very reliable in supplementing the grid to make sure that our health facilities can be able to have independent power supply when there is prolonged periods of load shedding. Thank you.
No, thank you, Chair. There was a question on floods, and can report that there is an interministerial committee on floods led by COGTA, because the declaration on state of emergency has already been declared nationally. So we intervene in every province on case-by-case method. And we've had to approve the building of bridges in different areas so in the Eastern Cape, where the bridge was swept off to enable people to move, we've asked and we've ordered materials as the Department of Defense to build temporary bridges in areas where they've been taken off. So it's not province by province, because provinces report to COGTA and at a national level respond with the provinces, but they report where they need services from government. Some of the services they are able to do on their own in provinces. But what it helps with the interministerial team, we even get the weather section giving us alerts on a daily basis, which then we give to different sectors. For instance, in schools, we will advise to say, in this area, there are threats, children should be kept away from school, and alternative methods should be done. Again, the provinces will report to say the bridge has been washed off, so people don't have access to medical services. Therefore, the Department of Defense again has to fly or to really take medical services to different areas. So the response has been national because the state of disaster has been declared national. But in some instances, provinces are able to respond on their own. If Gauteng finds that it's a small stream which they can deal with, they don't report it at a national level. But the state of disaster has already been declared nationally, and therefore everybody is able to benefit from that national framework or from that national declaration. There was also a question on what are these different subjects we're talking about, and Dr. Polio will help me, but for instance, on the vocational stream, we have different streams. As I said, we have your vocational stream, but we also have your technical stream. For instance, on the vocational stream, we have technical maths and technical services. For instance, we have civil technology where we do construction, woodworking, and civil service as civil technology stream. We also have then electrical technology where we have power systems, electronics, and digital systems. Then we have mechanical technology, we have automotive, as I say, we were given about 240 engines by Ford South Africa, but different companies also cooperate with us. I know for a fact Volvo has been requesting partnership with us to make sure that the skills of servicing their cars after the motor plan ends can really be found in communities, because they've discovered that some of the companies like BM, which has trained people in the township, people are no longer scared of buying because they know if the motor plan ends, they are qualified, accredited people who can deal with the services. So different companies are also coming forth. But it's not only Volvo, as I say, it's different companies. I'm just citing Ford South Africa because it gave us the biggest slice, but we work with different companies. We also have, as I say, on mechanical technology, there's automotive, there's fitting, machine, welding, and metal work also, which is happening in our schools. There's also then, as I said, there's a vocational and there's a technical. So the vocational stream has, as I said, engineering, graphics, and designs. We have civil technology, we have electrical technology, we have mechanical technology, we have technical maths and technical science. So that will be your vocational stream. So I'm trying, Dr. Potter, to get your... Yeah. So we can also give you facts about the participation rates. And then on the vocational stream, the subjects that we offer, for instance, on the vocational stream will be your... Obviously will be your language, your maths and your science skills. It will be agricultural studies, arts and craft, office administration, early childhood development, mechanical technology, mechanical, I spoke about electrical technology. No, sorry, I'm counting the technical. I want to go to the occupational stream, sorry. It's things like personal care, your hairdressing and beauty care, your personal use of technology, your upholstery, technology of maintenance, consumer studies, like your sewing, food production, hospitality services, wholesale and retail, civil technology like bricklaying and plastering, civil technology and plumbing. And these are offered at different levels. I've been able to visit some of the schools in Gauteng where you have, for instance, schools for children with special needs. Some of these courses here then go at a school level to complement the curriculum, where children will be made to do certain, say, maths, languages, and then they're given some of these subjects as part of their vocational skills. And it's already happening, and Gauteng has advanced with a number of special schools that are focusing on these skills. Other occupational, they already have your, next to the airport, your aviation school. There's a specialist at a high level where they will want kids with high maths and science passes. On the other hand, they will also have, as I say, your occupational stream in special schools where you really want to enrich the experience of children who will not be able to cope with the curriculum. So we're differentiating now, even in terms of learners' abilities, interests, and gifts. Their kids are very gifted in arts. Rather than put them in a stream which they would not have interest in, again, they are being directed and advised to move into those areas. So different provinces at different levels in introducing this, because it's resource intensive, the process is a bit slow. But what is heartening is that parents and children want their kids to go into these areas. There will be schools when we open, every parent will want to see their child going there. For instance, if even the young people, when there's motor mechanics, they all want to go and study there, because their pass is equivalent to the matric pass. And fortunately for us, with the removal of NATED subjects, they can go straight to tertiary with any other criteria. So it doesn't mean that if you've done a vocational stream, you've been doing technical maths, you've done any engineering at high school, you won't be able to go and do engineering at universities, because we've really developed a framework with higher education to allow, to recognize those subjects. And that has really opened up the path to ensure that parents now are comfortable and are willing to advise their kids to go into some of these technical subjects. But it's a long stretch, but it's a very exciting and interesting path that we're embarking on. But it's a bit slow because of its resource constraint, because of the constraints we have financially.
Thanks, Minister. Sorry that I have to pop up and down because my mic seems to be playing up. You know, guys, I was just thinking, Minister Motshekga, I don't know if I'm too old, but I just thought, imagine if I had to go back to school and learn one of those things, how to fix solar panels. I could get a lot of work, Dr. Phaahla, fixing solar panels on hospital roofs. Maybe it's a good retirement plan. And then also the challenge, colleagues from the media, you hear, yeah? Tseho is your name, DBE TV. There's your challenge. Imagine how exciting it would be to go and see that aviation school. I'd be very interested to see what's going on there. And that's something you guys can take up afterwards, because those are the things when the President said, we leave nobody behind. The Minister's giving that sense that this new range of opportunities, it's what we've been looking for. So I'm aware now that we have some questions online. So Mr. Makwebo, can you take us to the online questions, please?
Thank you, DG. We have a question from Alistine from Spotlight, and the question is if the Minister can give some more detail on how the 23 billion rand over the MTF will relieve the health workers, and if it will also go towards appointing the health workers. And also from the same journalist, if also more detail can be provided on how the health infrastructure budget will be used to relieve the load shedding pressures with time frames. And lastly, from the same journalist, who said we don't see any allocation for National Public Health Institute of South Africa in the budget. And can the Minister explain the thinking behind this, please, on how the National Public Health Institute of South Africa will be supported or financed? Thanks.
Okay. Taki, is it Allison? The name of the journalist?
Alistine.
Alliston.
Yes.
All right, thank you, Alliston. Is that it? And then let's take one last round inside the room. I think that we can start moving to conclusion. Again, basic education TV. So.
Thank you. Thanks for that challenge. I'll think about
Yes,
it.
you will definitely have.
Ministers, I don't know who will be able to answer it, but the consent forms when it comes to the measles vaccinations and all the other vaccinations, or the immunization of children, are you seeing that the parents are actually taking up these consent forms and allowing their children to be immunized? Because if you remember with the COVID-19 outbreak, there were concerns around that as well when it was time for the younger generation to be immunized. So yeah, how's it going with the measles immunization and everything else that the children are being immunized against in schools? Thank you.
Okay, very good question. Nos from SABC.
This is just a follow-up for the Minister of Education. Could you just give us an update on the school placements, inland schools as well as coastal schools? How far is that process? And just another follow-up for the Minister of Health. In terms of timeframes for the budget that you're going to be using from the next financial year, what timeframes are you looking at in terms of improving the load shedding cables issue, and what oversight is in place to make sure that the funds are going where they should be going and they're not misappropriated. Thank you.
Okay. Minister says that. Okay. All right, those are very useful. And I'm going to start drawing to a close, because I'm sure the two ministers will field those ones and then we'll be done. Okay, Tagi, are you covered? Right, over to you, ministers, and I think we can draw to the second round.
Unless I'm mistaken, Elijah or Dr. Pule will help with the placements. And the DG's not here. The last time, and unfortunately we'll only be meeting tomorrow in Triple M with the provinces to check where the progress is. But the latest I know, there were no challenges. The problem was overcrowding and the arrival of your mobile classes and the usage of unsuitable spaces like churches and halls because they're outside the school. So there were just a number of logistical problems in terms of where we would have put children in the meantime. In some provinces, for instance, the Eastern Cape kids were, which is not even proper placement, were put in a library and then the schools. So completely unworkable situation. And that's what we're dealing with the latest. So and that's what we're mitigating against. And I'll only be able to get we have a Triple M tomorrow and a CM on Thursday. And I'll get the latest on Thursday. But the last time I got reports, it was just dealing with these unworkable places that we had put children in. Some provinces, they put them in churches, which are not necessarily in the schoolyard, so it meant teachers had to be traveling between the church, the feeding. So there were just lots of issues. As I said, somewhere in the libraries and public libraries, which were not in the schools, were to sort out issues of security and just making sure that they get effective learning. So there were still issues which now are beyond just seats in the classrooms, but effective teaching. On the question of consent forms, I was trying to whisper to Minister. I was quite surprised during COVID when we experienced resistance in signing consent forms, because we've never had that difficulty before. And I used to go to raise even with teachers to say, but you know, by law, you can't have an unvaccinated child in the schools. Where we had outbreaks, half the time it were children who were not South African children who had not been vaccinated through our health system. Where we'll have an outbreak, we will, without doubt, even when I was MBC, I knew it would be a child, not a child born within the South African health system. So we've never had resistance and any difficulties. If parents don't sign, it's because of negligence, the forms are misplaced, then we have to follow up, but not that there will be resistance. So even the measles vaccination, half the time the problems were just difficulties of getting forms back. But when we follow up, and sometimes health workers even visit families, will get the forms, those consent forms. It's just that by law we can't vaccinate unless we have a consent form in our hands. But there's not been any resistance from my experience. But I have colleagues in the department. Dr. Paul, I want to confirm that we've never had vaccine resistance. It was only during COVID, and certain religious groups, for certain reasons, and not because they didn't want vaccination, but they had religious reservations about the contents of what was in the COVID vaccine. But the other vaccines were never questioned, and we've always had successful return forms. And yeah, so I thought I've answered the two questions that came to me. Thank you very much.
Thank you very much, Minister Motshekga. Indeed, just to confirm that all the other vaccinations, whether it be measles, the human papilloma virus vaccination, we run those annually, and there's not been any resistance. So the resistance started when we were dealing with the COVID, because these ones are well established. The protection against illness, it's well established over many years. So that's why even now, when we have isolated outbreaks of measles, it's largely because of the fact that during the lockdowns and the various restrictions of the high levels of COVID, parents missed taking their children to vaccination because of all those circumstances. But also in some cases, even our health facilities were too much focused on screening and also, providing support and treatment for people who were affected by COVID. So we're catching up on that. That's why you will see that it's isolated cases, starting in Limpopo, going to Mpumalanga, Northwest, and now it's moved even further west coast into Cape Town. But again, it's still small numbers, but we have very good cooperation from parents and the education sector, so that we can confirm. We are indeed very grateful for the announcement by the Minister of Finance on Wednesday that over the next 3 years, 23 billion will be sourced to support the health sector, largely in terms of the very pressing areas of human resources. Our team will be sitting with the team from Treasury to work on the details, but we're quite optimistic that you'll be aware that we've been under a lot of criticism and a lot of pressure over the beginning of this year with a number of medical doctors who have finished.
There you have it, the Minister of Health, Dr. Joe Phaahla, with the Minister of Education, Angie Motshekga, just giving us a list of interventions coming in the coming year.